Hi, I'm Dr. Jen Kinder, excited to share with you our study, the feasibility and acceptability of protocol-based telehealth treatment for stress urinary incontinence in postpartum women, a pilot randomized trial. I'd first like to thank the institutional funding of Notre Dame Dana Muir University and University of California, San Francisco, the participants, the pelvic health physical therapists, and somatic health for their donation of videos. We know that parity is associated with an increased prevalence rate of urinary incontinence, and that the prevalence of stress urinary incontinence 6 to 23 years after first vaginal delivery is found to be 30%. It's estimated by 2050 that 43.8 million women will have at least one pelvic floor dysfunction, and that there's a prediction of an increase in demand of care by 42.7% by 2050 for the care of pelvic floor dysfunction. There's an unmet need and a need of a novel approach to fulfill this unmet need. We know that both in-person and online pelvic floor muscle training have been shown to be effective in curing stress urinary incontinence. However, they've been shown independently from one another. There lacks substantial evidence of telehealth's effectiveness compared to in-person care. Really, an apples-to-apples comparison is needed. The primary purpose of this study was to assess the feasibility of participant recruitment, retention, adherence, and acceptability of a pelvic health physical therapy program delivered by telehealth. The secondary purposes were to explore the potential efficacy of a telehealth treatment program for stress urinary incontinence in the postpartum population and compare those telehealth outcomes to usual outpatient in-person postpartum pelvic health physical therapy in treating stress urinary incontinence. We recruited using the 3-incontinence questionnaire, where those who had stress urinary incontinence were then enrolled. Participants needed to be 6 weeks to 4 years postpartum and had not seen a pelvic health physical therapist in the past 3 months. We enrolled 30 participants. They completed their consent form and the surveys and were randomized to 2 different groups, the in-person or the telehealth group. We assessed the effectiveness of a 4-week online program for treating stress urinary incontinence in the postpartum population, and they were each guided by a pelvic health physical therapist in either the in-person or telehealth group. An example of what every physical therapist followed was a script, rather a protocol for treating stress urinary incontinence, and this is just a sample of that part of that script. We analyzed the questionnaires that were related to stress urinary incontinence symptoms at baseline, 5 weeks, and 12 months. We found no difference between groups at any of the 3 time points for any of the outcome measures. Within groups, we did see a decrease in stress urinary incontinence in both the in-person and telehealth groups, and some decrease in urge incontinence as well for both groups. And we saw this for the stress urinary incontinence at that maintained through that 12-month period. Regarding satisfaction of care, there were no significant differences between groups in the satisfaction of care. Both groups felt that they received good care and that their needs were met. And although the in-person cohort preferred their method of delivery over the telehealth group. Both the in-person and telehealth groups significantly improved in their stress urinary incontinence symptoms. There was no difference found between the in-person telehealth groups in improvements in stress urinary incontinence symptoms. There are limitations, that's a small sample size, we do need more power, and that this pilot will establish a sample size for the next trial. Interestingly, despite the program's effectiveness, good satisfaction, and the fact that there was more attrition in the in-person group, 9 out of the 13 of the telehealth group would prefer in-person care. Of the in-person group, some did drop because of childcare issues. 10 out of the 11 would still prefer in-person versus telehealth. This just supports that we need to be able to choose the mode of treatment delivery, and that's to reach as many patients as possible. We conclude that telehealth within the pelvic health physical therapy lacks substantial evidence for its effectiveness in treating stress urinary incontinence in postpartum women, and there's an increased need in comparing in-person telehealth in different populations. Participants in this study significantly improved in their stress urinary incontinence symptoms using an online program with no difference seen between groups. Clinically, a pelvic health physical therapy guided 4-week online program for treating stress urinary incontinence in postpartum women had significant improvements in symptoms. So there is hope for serving this unmet need. A question for you, clinically relevant speaking, despite 100% effectiveness of telehealth, why do patients prefer in-person care? Could it be just this population that we looked at? Could they want to just leave the house? Are there other psychosocial factors that we are not taking into account? And another question for you, how do pelvic health physical therapy guided online programs compare to non-physical therapy guided online programs for treating stress urinary incontinence and other conditions in postpartum women? Meaning there are a lot of online programs out there that are not led by a pelvic health physical therapist. So how would those compare in their outcome measures? Thank you so much for your time and attention, and feel free to reach out.